Hi, I'm Dr. Rajaram and I will tell about high blood pressures or generally the people or patients call as high BP, but in medical term we call as hypertension. So before telling hypertension, I will tell what is BP. So the blood pressure or BP, the contractions of heart muscles and relaxing of heart muscles, which is causing BP or blood pressures. So the contraction of heart muscles is creating systolic blood pressure and relaxations of heart muscle is creating diastolic blood pressure. So BP is measured in systolic and diastolic. So when BP is 120 by 80, the 120 is systolic and 80 is diastolic. And most of the times people doesn't feel any symptoms. The only way when they check it, they find the high blood pressures. And nowadays in Asia or in India, the hypertension cases are increasing, and the blood pressures or hypertensions timely need to check the blood pressures, and controlling the hypertension is very important. So the normal blood pressure is 120 by 80, as everyone know, but when we are practicing clinically, we consider 110 by 70, 120 by 80 or 130 by 90 is we call as normal blood pressures. So what the cause for high blood pressure? Why the BP suddenly get rise? What the reason for this? So older age, one of the main reason, because once people cross 45 or 50 years, they might get the blood pressure, high BP, and genetic. If their family history, like their family, like mummy, papa, they are suffering with blood pressures, they will get the high BP. And excessive use of alcohol, smoking, tobacco, which is causing high blood pressures. Intake of high salt diet, physically inactive who is not doing any physical active like exercise and all, overweight or obese, and high cholesterol which is causing high blood pressures. When the cholesterol is high, it is getting deposit in arteries or blood vessels and causing narrowing of blood vessels, which is increasing the BP. And other reason like stress, work pressure, not sleeping properly, and some issue like family issue or money issue. So these are the causing of high blood pressures. So what are the symptoms you will see when you have high BP or when you are suffering with hypertension? Most of people, they take the medicines from medical store like headache or vomiting, but they don't understand. So the symptoms what you are going to see in high blood pressure: headache, dizziness, blurred vision, nausea, vomiting, irregular heartbeat, chest pain, and anxiety. So the people who is feeling these symptoms, and when blood pressure is too high like 160 by 80 or 180 by 100, they might get nose bleeding and uncontrolled blood pressures or high hypertensions, which may lead stroke also. And if someone is suffering any above symptoms, so please, you need to take care immediately. You need to visit a healthcare professional and check your BP once, and always ask your doctor or health workers to check your BP manually instead of checking electronic BP I have seen lot of difference between manual BP and electronics BP. So what the treatment here, what the goal, what the tips to control your blood pressure is very important to know. If someone is suffering with hypertension, the diet is very important. So fruits, vegetables, and drinking lot of waters, and avoiding alcohol, smoking, or tobacco, or high salt diet, they should avoid. And sleeping on time, avoiding stress, this is all helping to control your blood pressures. Physically active like cycling, swimming, running, walking, these are reducing your cholesterol, which help to control your blood pressure. And if you, along with that, the medications which you required, so AC inhibitors like enalapril, and angiotensin 2 receptor blockers like telmisartan and losartan, and calcium channel blocker like amlodipine. And so these three groups you can choose any drugs to control hypertension. Depend on the situation how you are going to select the drug. And diuretics like hydrochlorothiazide and other symptomatic treatment as patients required while the examinations. And one more important things, once you are taking the hypertension medicines, you don't discontinue till your doctor advice. I have seen a lot of patients, they are taking hypertension medicines, they will take for 1 month, 2 months, or 15 days, they will leave, and suddenly they will come with 120, 200 by 100 or 180 by 100. Suddenly the BP rise. When you ask the patient about their history, they are, sir, I was taking, but I discontinued the medicines. So don't do like that, because you don't know the seriousness of hypertension. I think some people have knows that if they are suffered like a stroke like bleeding in brain. So these kind of conditions should not create. And please follow your doctor advice and continue blood pressure medicines. Should not stop without your doctor advice. And please see this video and share this. Thank you.